Hey everyone, I am Dr. Ravina. I am an NHS women's health doctor and Femtech founder of Zonas. So this is one of my first videos, so we're just going to see how this goes. And I thought we'd kick off with a topic that I get asked about all the time, and that is common questions about women's health. So common gynae issues, common issues to do with your periods, to do with your discharge, and all those taboo topics that women don't really like to talk about. But as soon as you come to a women's health doctor, everyone likes to just spill out all of their deepest, darkest secrets that they've never told anyone. So I thought, why not share that? Because if one woman asks it, I'm sure many women have the same question. So I'd like to answer 5 of the top questions that I get asked. So, question number 1, is it normal to have vaginal discharge? So that is something that I get asked by all women, whether they are very young girls who haven't even started their period yet, so prepubescent girls, or whether that be women of a reproductive age who are looking to get pregnant, or even menopausal women who are coming to the end of their reproductive years and perhaps don't even have periods anymore but are still getting discharge. So, is discharge normal? The short answer is yes. We all have vaginal discharge. Every woman will have some kind of vaginal discharge throughout their life, and this will vary from person to person. I will go through a video talking about all the different types of vaginal discharge, but the one that I'm going to talk about now is your physiological discharge. And this discharge is basically what every woman will produce at various different times of their menstrual cycle. So if you're ovulating, you may produce slightly thinner, watery discharge in comparison to other different times of your menstrual cycle. But in essence, vaginal discharge is completely normal, especially if it's clear, non-odorous, so shouldn't really smell of anything. The quantity can vary, so you may have very thin amounts at some parts of your cycle compared to others. But what I do want to really just hone in on is the red flags that you should be aware of are: 1, if there's a change in the colour, so if it turns yellow, if it turns green, if you see bits of blood in your discharge that isn't blood but actually discharge, that's something you need to be aware of. If you get any change in your smell, so any sort of fishy smell, if it just doesn't smell normal for you, and you will know what normal is for you. So if it feels different, then that's a time for you to talk to your doctor. If you notice any changes down below, so around the vulval area, any itchiness, any redness, it's just really sore, come and see your doctor. So those are your red flags for vaginal discharge. So that's question number 1. Question number 2, will my tampon get stuck inside? So I remember when I was at school, and wearing tampons was like something that you would have to be quite mature to do. You wouldn't start off wearing a tampon, you would start wearing a pad, and then when you felt more comfortable, you'd wear a tampon. And that's because there are so many myths and worries about wearing a tampon. So what a tampon does is you insert it into your vaginal canal, and that will absorb all the blood. And you can keep that in for up to 4 to 6 hours and then remove it. So that's different to a pad where the blood actually comes out of the vagina, and then it will sit in the liner lining your underwear. So can a tampon get stuck in the vagina? And the answer is no, it can't. And I think you may hear some horror stories, you may have read in the Daily Mail horror stories of the tampon being stuck, but it's really, really uncommon and unlikely. The reason for that is because the tampon goes into the vaginal wall, it sits in the vaginal canal, and it then is unable to go up into the cervix, because your cervix is a very tight hole and it's usually closed. Most of the time it will be closed, and that cervix is your entrance into your womb. So there's no way a tampon, even if you push it all the way up, will get into your womb. So that's number 1. Number 2 is, can it get stuck in the vagina? So one of the worries are, if you put something up there, say if you lose the string, say if you can't find the string, how do you get it out? Well, The good news is tampons are really well made, and the chances of the string being lost is really, really minute. So the likelihood is, if you can't find the string, it's probably just stuck within the walls, and you might just have to do a bit of digging to actually find the string to pull it out, to pull out the whole tampon. And the tampon will come as one whole piece. There's no risk of it disintegrating and sort of separating up within the vaginal wall, within the vaginal canal. And the reason for that is because when your tampon absorbs blood, it then sticks together. It then sort of becomes more moist, and that allows it to all just be as one unit and be pulled down as one piece. Now, in the worst case scenario, so in the scenario that you can't get your tampon out, what are you going to do? Okay, in this scenario, it is a good idea for you to talk to your doctor. You don't need to go to hospital really, unless you can't get a same-day appointment, but it's not usually an emergency. Usually you can get it out. But if you can't get it out, then get an appointment with your GP and they can do a speculum examination. So speculum is a long plastic tube that they put into the vagina, very similar to what they do in a smear exam. And they'll put that in, and they can use forceps just to gently ease the tampon out. So it's not that worrying. It's very easy to remove if it ever does happen. But to be honest, I've never seen it, and it's so unlikely to ever happen. So I hope that's reassuring for those of you that are common tampon users. Question number 3, how do I know if I have an STI? So an STI stands for a sexually transmitted infection or a disease. Commonly in the UK, chlamydia and gonorrhea are the 2 main STIs, and they're very common in people between age 20 and age 30. So how do you know if you have an STI? Well, the first thing is, if you have any suspicion that you may have one, you need to go for a sexually transmitted infection screen. So your local STI clinic will have this, your NHS clinic that's local to your hospital, and that's usually self-referral. You book yourself an appointment. If you're a bit embarrassed to do this, and trust me, many young people are, but that is completely normal, and healthcare professionals understand that. That's why you have the option to also do a STI screening test at home. So there's 2 different types. You can do one that looks at your urine sample. There's also a type that you self-swab, and I also know that you can get a blood test where you take a few finger pricks and they collect your blood, and you can then check whether you have any STIs. So if you think you have an STI, the first thing is to check, okay? And some of the symptoms that you should look out for, and some of the red flags to be aware of, are 1, specifically for women, do you notice any bleeding after sexual intercourse? If you do, you need to alert your healthcare professional, let your GP or your sexual health doctor know. Second, this is for men and for women. Do you notice any peeing, any pain on peeing? So do you feel any burning or stinging sensation down below? This may be a urinary tract infection, but we have to also rule out a sexually transmitted infection. 3, also for men and women, do you notice any discharge coming from down below? And as I mentioned, not discharge that's normal for you, but something that's abnormal. So is it yellow? Is it green? Is it smelly? Are you producing lots of it? Is there any blood in the discharge? So those are things that I want you to look out for in terms of your discharge. And that may not even present as soon as you've had sex. It may happen a few days after. But it's just really good to be aware, and especially if you've had a change in sexual partner, if you haven't used any barrier contraception. So even if you're using the pill, if you're not using condoms or any barrier, then there is a risk of you transmitting and catching a sexually transmitted infection. So that is question number 3. Question number 4. So this is a question I get asked so often. I think it's probably the most common question I get asked. And that is from women who ask me, just before I do a vaginal examination, it is, does my vagina look normal? Now, I always used to think this was quite a funny question. First of all, I can't actually see the vagina straight away unless I use a speculum and I have a good lighting, I have a torch, so I can see inside the vaginal canal and look at the walls. So first of all, I can't actually see your vagina just from the outside. What I can see is the vulva, and I think that's what most women mean. And I find that really funny because most women don't really know the anatomy of down below. They don't know what parts their vulva, what parts their labia, what parts their clitoris, what parts their urethra. So I think that's actually really interesting that most women think, oh, that's my vagina, but actually your vagina is an internal structure and an internal pelvic organ. So does my vagina look normal? That is what I always get asked. And yes, all vaginas and all vulvas actually look normal. They come in different shapes, they come in different sizes, they come in different colours. Some people have pigmentation, some people have pale vulvas, some people have very pinkish vulvas. Some people have a labia that's longer or shorter than the other, and they don't have to be symmetrical. In fact, in most cases, they're asymmetrical. I haven't seen many that are looking completely symmetrical on either side. And that is completely normal. People get quite upset about one side not looking the same as the other. And I think what's really important to know is the function of your vulva. Now, your vulva is made up of your labia majora and your labia minora, and they're the lips of the vagina. So the purpose of your vulva is to just look after and protect the delicate internal structures that lie inside. So that's your vaginal canal, that's your urethra, that's your clitoris, that's your glands within the vagina that produce mucus and secrete liquid, and that allows there to be lubrication in your vagina. So what's important is that we don't fiddle around with the vulva too much. We don't operate on it. We try and keep it as preserved as possible because it's a really important structure to look after our vagina. So that is the answer to question number 4. Okay, so question number 5 is more of a series of statements that people have asked me, and I want to just dispel many myths surrounding sexual health and women's health. And I think there's a lot of myths that you can read about on the internet. There's so much misinformation that people get from online, but they're not always evidence-based, they're not always scientific. So let me just go through a little list that I've got from statements that people have asked me. So the first is, can kissing cause me to have an STI? And the answer is no, you can't catch an STI from kissing. You generally get STIs from bodily fluids like semen, from female discharge, from blood, but you can't get it from saliva. Okay, so you can't get an STI from kissing. The second thing was, can you catch an STI from a toilet seat? So this is perhaps if people are out and about, if they're in a public place, they may get worried that, oh my goodness, I might catch something if it's looking a little bit dodgy and not so clean. So can you catch it from a toilet seat? No, you can't catch an STI from a toilet seat. But of course, it is really good to be clean, and if you notice that the toilet seat isn't very clean, it's good just to wipe it, just so that you don't increase your risk of any urinary tract infections. Okay, the next is, should I be washing my vagina? So washing your vagina is fine, just as you wash the rest of your body. But what some women do is something called douching. And douching is where you insert lots of water inside the vaginal canal, and that's inside the body rather than just the outside skin. What we should be doing is cleaning, our skin and obviously the outside, but we shouldn't be douching. Now, douching is throwing lots of water inside, and that gets rid of all the nutritional things that we need in our vagina. It gets rid of the mucus, it gets rid of the important nutrients like prostaglandins, it gets rid of the lubricant, and it actually changes the pH. It can change the pH of the vagina, and we can go on to pH in a different video, but it helps to, it will stop the neutralization and the natural flora within your vagina. So no, you should not be douching. And the last one I've got is, can I have sex when I'm on my period? Now, this is completely a personal choice. Technically, yes, you can have sex whenever you want, but of course, if you are bleeding a lot, it may not be comfortable for you, it may be a little bit messy, but that's no reason for you not to have sex, especially if you're trying to conceive, if you're trying to have regular sexual intercourse, you can still have it when you're on your period. And what we do advise is to have sexual intercourse about 3 times a week if you're looking to get pregnant. So yes, you can have sexual intercourse whilst you're on your period. So anyway, that rounds up the 5 common questions that I get asked as a women's health doctor, and I hope that's really useful. So if you have any other questions that you'd like to ask me, then feel free to DM me at dr.ravina on Instagram, or even in the comments down below. I'm happy to either answer them in the comments or actually just start a new video and explore all of those questions that you have for me. So anyway, take care and stay tuned for the next video. Take care, bye.